Hello, I am Dr. Vishal Bhende and I am excited to welcome you to a space where science meets surgery, tradition meets innovation and pediatric care gets the spotlight it truly deserves. I have the privilege of serving as guest editor for the Cureus collection titled Revisiting Pediatric Thoracic Surgery, which was launched on May 17, 2024. This collection is a call to action for all clinicians, surgeons and researchers passionate about advancing care in this vital field. Why this guest editor collection matters? Since launching, we have already begun telling some truly remarkable stories. We kicked things off with a sweeping review titled The Legacy of Innovation, tracing eponymous procedures in congenital and pediatric heart surgery. This isn't just history, it's the DNA of every thoracic surgeon's training. If you have ever performed a Blaylock thoracic or a Ravitz, you will want to read this. Then came the Ingenuity, a first of its kind case where the thymus was reimplanted during the first superior cavopulmonary anastomosis. Reimplanted. A bold anatomical decision with real immunological implications. That's the kind of surgical thinking this collection thrives on. We also introduced the Bhende Patak hernia, a rare convergence of congenital diaphragmatic hernia and congenital heart disease, two major anomalies managed together with precision and poise. A surgical balancing act turned into a success story. Then from Morocco came a compelling case on a primary staphylococcal lung abscess in infants, an unusual infection expertly managed. These global voices are enriching our conversation. We looked at the most cited articles on early thoracotomy and decortication for empyema through a global bibliometric lens. This article doesn't just report numbers, it reveals how ideas travel and how certain interventions reshape entire disciplines. Let's not forget the recurring puzzles. A child with recurrent lung abscess, an adolescent with a pulmonary hydrated cyst and extrapulmonary lesions, two children with CPAN, each needing a distinct surgical plan, each outcome equally inspiring. And in a field that's constantly pushing boundaries, we featured a neonatal lobar emphysema managed by ultra-thin bronchoscopy guided endobronchial block, a reminder that when tools evolve, so does what's possible. Each article in this collection isn't just a publication, it's a window into a clinical decision, a lesson in surgical judgment, and a testament to teamwork. What we are looking for? We invite submissions that span the spectrum of pediatric thoracic care, original research, compelling case reports, technical innovations, and state-of-the-art reviews. Topics of interest include congenital lung lesions, mediastinal tumors, thoracoscopic approaches, airway reconstruction, neonatal surgical strategies, and collaborative interdisciplinary care. Whether it's a rare case or a robust data set, if it informs, inspires, or improves outcomes, we want to feature it. Why Cureus and call to action? Why publish with Cureus? Because it is fast, fair and free. Cureus is open access, PubMed index and designed for clinicians like you who want their work seen, read and cited without months of delay or financial barriers. And here's the best part, your work won't just sit in a database. It will be part of a living, breathing collection that gets shared, reshared, cited and remembered. So if you have got a case that made you think twice, a review that should shape the way we teach, or research that could guide policy, submit it now. Let's build this together. Let's revisit pediatric thoracic surgery with fresh eyes, bold ideas and global voices. Because when we share knowledge, we save lives. Better, faster and smarter. Thank you for your commitment to advancing pediatric thoracic surgical care. We look forward to your submissions and to growing these meaningful conversations together.